Welcome everybody to Go Local Live. It's 12 noon. We all know what that means. It is Dr. Fine time, our daily discussion with Dr. Michael Fine, former director of the Rhode Island Department of Health. Dr. Fine, thanks again for joining us today.
Good to see you, Jed.
Okay, let's jump into, let's go to the White House briefing yesterday. The president came forward and said, hey, listen, the numbers in a best case scenario is 100,000 to 240,000 deaths in the United States. If we, in his words, if we hadn't acted quickly, the numbers might be as much as $2.4 million, 2.4 million deaths. Yeah. What's your interpretation of that press briefing, and what's your takeaway from it?
Well, you know, I think the people close to the president are persuading him of the seriousness of this, you know, and I don't want to second guess the president or try to understand how he thinks, but, you know, clearly we're now seeing it on television from New Orleans and from Chicago and from New York. And so it's not, you know, some isolated incident. This is clearly something that, you know, I think the president is beginning to understand what some of us have been saying all along, that this is a disease that everybody's going to get, and its impact on the population as a whole is predictable. And it's really different from anything else we've seen recently because everybody's going to get it. Nobody's got any immunity to it. So I think the president is sort of finding his way to understanding what we've actually got in front of us.
Juxtapose Rhode Island yesterday. We talked a little bit about it. Going up to it, the governor said that the University of Washington modeling, which is now one of the models being looked at by the media, the White House said that they've been looking at those numbers as well, says the University of Washington numbers say about a little less than 300 deaths, about 270, and that the surge, the highest point, will hit on, I believe it's April 20th. The governor, in response to that, said, no, actually, our modeling, which she has not disclosed, shows it coming later in May, and that the numbers of fatalities are higher. What's your thought on that juxtaposition between the University of Washington numbers and the governor's utterance?
The modeling is only as good as the assumptions that are built into it. And we learn to tune these assumptions as we learn more about the disease. You know, the University of Washington modeling is pretty much the modeling that I came up with a couple of weeks ago based on the Wuhan numbers. That's the most optimistic, and that assumes we did what Wuhan did, which we didn't do. So we're going to be informed by, you know, watching our numbers and the progress. And I'm not sure the modeling really matters that much. You know, at the end of the day, you know, it certainly is helpful in terms of resource planning, but I think you got to, you know, sort of plan for what happens with this thing getting loose, and then try to do the best you can to shrink the height of the curve and build up the resources we have to take care of people when they get sick. You know, I've been saying all along, I'd be more comfortable if we were totally ready to go tomorrow in terms of maxing out our ICU beds and having our health workers and our health workforce ready to go. And I'd love to see isolation hospitals, because that's what Wuhan did. But I don't know how soon we're going to be able to get all that stuff done logistically. And I also don't know how much the differential impact of how we've done social distancing and how the very strict way it was done in Wuhan is going to affect disease transition. And frankly, nobody knows that. That's something we'll learn 2 years from now as we study the outbreak in retrospect.
Two data points on Wuhan. Professor Kate Mason, an anthropologist up at Brown University, I think was on with us in February. She has a deep experience in tracking the SARS epidemic. She was in China at that time. And she said, listen, you can't believe Chinese numbers. You can't use them for modeling. The second thing is, and this is only taking place as Wuhan has begun to recover, is some Wuhanians, I'm not sure what the terminology is, but folks who live in Wuhan are reporting out that the numbers that are being distributed by the Chinese government are wildly underreported, and saying that the death toll was significantly higher. So, that data point, I think, has questions. One, because of Chinese governmental control and lack of transparency, and now firsthand knowledge of people who live in that community raising questions about it. We've now got data from a number of hotspots around the globe, obviously Italy and Spain being very disturbing trends, and we're not quite seeing that level of A, surge, and B, mortality rate. Do we have numbers out of New York yet that lets us know what we should expect during a surge?
This is where this is so difficult. None of us have ever really believed the Wuhan numbers, but they were the only numbers we have. And that's what our limit was. And the problem is that populations and policies are not directly comparable. So New York, got going late. It did social distancing in a certain way, and it has a level of population density that's not like Rhode Island exactly. And that's where, these are suggestions, but they're not scientific facts. They're ideas that help you do some planning, but you can't believe any of it absolutely. You have to use your thought process yourself. So, some of us didn't believe what CDC said when CDC said in February that the disease couldn't be transmitted by somebody who wasn't symptomatic. The CDC put that out. I don't know where they got it from, but it clearly wasn't true then.
Right.
And we built a bunch of assumptions based on that. Unfortunately, I wish more of us had been effective in getting our policymakers to question that assumption, which was clearly wrong. Because we're now saying 25 to 50% of people have it asymptomatically and can transmit. We built our whole beginning intervention on what somebody said, even though it was not only wrong, but most of us with a little experience questioned it from the get-go. That's the kind of critical thinking we have to bring to this, looking at the numbers critically, but also, sort of knowing a little bit about how disease transmits and, how you address population transmission. You got to bring a critical perspective to it, so you develop programs and approaches that may not be directly suggested by the science, because the science isn't that good. You sometimes get to the point where you have to use your best judgment, and I think we're kind of in that realm.
Are we yet being forceful enough in implementing social distancing? I'll give you an example. This morning, the National Guard had a press conference out at, I believe it was CCRI in Warwick. Our media partner, Latino Public Radio, was there videotaping it. He did a scan of the other journalists, and literally there were journalists standing right next to their camera person, another journalist standing 2 feet away from the other 2 journalists. The National Guardsmen did not seem to be 6 feet apart, didn't have a tape measure, but is there just enough? I mean, God, the governor said it maybe 1,000 times, wash your hand and stand 6 feet away. Why is this so difficult for us as a society to be able to implement this on a consistent basis?
We're not used to it. Simple as that. And, this is a discipline that will develop over time as we raise consciousness. Look, what the secret that nobody knows about the Ebola outbreak in West Africa was that it wasn't actually stopped by hospitals, and it wasn't stopped by doctors. It ended up being stopped by a process of community organizing that partners in health thought out to help people in communities think critically about what their risks were and how to limit their risks, and to make sure people were getting that information from trusted sources, because they didn't believe the government at all. And that, to me, is what we're going to need to do. We need to get everybody involved, so it's not I'm going to stand 6 feet away because the governor told me to. It's going to be I'm going to stand 6 feet away because I know that that's what I need to do to protect you and me and our families. It's a different process, and one some of us are just beginning to start working on.
Let's go to the numbers. We saw significant increases in a number of the main categories that we've been tracking. Walk us through.
Well, always 185,000 recoveries. Start with that one. We are now very close to 900,000 cases around the world, which means we will be over 1 million in a day or a day and a half. We're going up by 75,000 to 90,000 cases a day around the world. Again, some of that's disease progression, and some of that is developing more measurement. In the United States, we're up 24,000 cases in 24 hours at 190,000 cases. But, we know from looking at flu numbers that in the United States, we're going to be, at the end of the day, 50 to 100,000 cases over the next few months. I'm sorry, not 50 to 100,000, 50 to 100 million cases in the United States. So our 190,000 cases now is a drop in the bucket compared to where we're going.
So let's stop right there. We're at a little over 4,000 deaths. We're pushing 200,000 cases. If that trend continues, we're at a 2% mortality rate. Italy's at about 11% mortality rate. If you're correct that 100 million Americans are going to contract this, and we're going to track 100 million, we would be at a 2 million number, not a 200,000 number for the number of deaths in the United States.
If we don't tune up our social distancing. And I think what you're seeing, remember, the disease you're seeing today.
But if it's 100, just hold with me for a minute on the math. Whether it's social distancing or not, if we've got a 2% mortality rate, we've got a 2% mortality rate. If we're at 100 million cases, that's 2 million people.
That's correct, but remember, the cases and the mortality we see today reflects the process that we were using 2 to 4 to 6 weeks ago. So as we change and tighten our process here and around the country, our better outcomes will show up 2 to 4 weeks down the line. That's what they're seeing in Seattle, where they're seeing some impact of social distancing. And that's what I think we will see as we get better and better at this. Our messaging is improving by the day. We're helping people understand now what they need to do when they get sick, that whole business about finding a room to go in, isolating yourself in a room. Some of us are saying, put a mask on if you're sick. Really make sure that your family doesn't go out for 14 days. That's new information over the last week. And as we get that disseminated and as people understand it and adopt it, I think we will do better. And I'm hoping we will end up at a half a percent to 1% mortality rate among cases, among people who are tested, remembering that 25 to 50% of the population will have this asymptomatically.
Okay. Other numbers, are we learning anything from the European countries, which in many cases are more similar to the United States from a structure of communities, how we live together, how cities function, than maybe a Wuhan does?
Honestly, I haven't looked that closely at the European numbers. I've been focusing on our numbers and the numbers around the world. But a comparison is only as good as the denominator of comparison allows. So even though we're more similar, are we similar enough? How similar are we? When did we start social distancing? What kind of social distancing did we start? When did we stop schools? When did we restrict all activity? Everybody's doing it a little differently. So unfortunately, when you've seen one outbreak, you've seen one outbreak.
What's been the biggest aha you've seen in the last 24 hours, good or bad?
I think the biggest aha for me was recognizing that testing isn't going to help us at all until we get some kind of isolation process. And that said to me, let's change what we're doing and really work on community organizing, work on getting communities engaged, and really get working themselves on how to change things internally. That's a big difference, because before that, for me, this was all kind of a top-down process. You know, we're going to organize the National Guard and we're going to build hospitals. You know, suddenly the light went off in my brain that, you know, new hospitals aren't getting here for a couple of weeks at least. So we have the opportunity and the challenge to do it ourselves and to start now. That was a big change for me.
Dr. Fine, I want to thank you so much. I had 5 phone calls this morning. They range from attorneys to a news source to a Rhode Island state judge. All 5 of them, without exception, wanted to thank us for bringing you on air on a daily basis, and how helpful it is to get the insights from you and sort of straight speak that allows people to be able to have a good understanding of where we are and where you think people are going to be facing challenges in Rhode Island. I want to thank you again, as always.
It's a great honor to be here. Remember, we're doing this all together. There are no enemies here, only allies.
I did tease somebody today on a Facebook message who said exactly that. We're all in it together. And I responded, yes, we're all stuck together. So yeah, depending on your perspective. Last thing, programming note, we've got a number of things coming up this afternoon. Governor Raimondo has a press conference at 2:30. We'll be double barreling with Ken Doctor, leading expert on media in the United States. He'll be Skyping in. He writes up for the Neiman Lab up at Harvard. And also this afternoon, we'll be having a top physician from Brown's Warren Alpert Medical School talking about autism at 4 p.m. So I also want to thank Courtney Nicolato from the United Way, who came on a little while ago talking about 401 Gives. They're up over $600,000 in the one-day, $1 million effort, a $1 million challenge to help nonprofits across the state. If you haven't given yet, go to GoLocal, find the link in the article, and please make a donation to the United Way and your favorite nonprofit. You can give it directly to them, no administrative cost. Dr. Fine, thanks again.
Thanks, Josh.